Dysfunction diagnosis for the shoulder is going to look exactly the same as passive range of motion exercise we did last week. Remember, there are 4 possible somatic dysfunctions in the shoulder: extended, flexed, abducted, adducted. For extension, stabilize the scapula with your cephalad hand and move the humerus into extension. At extension, see if you can feel for the barrier. If there is truly a restricted barrier in extension, you would call this flexed right glenohumeral joint, or a joint prefers flexed position. Compared with flexion motion, this means the barrier is reached earlier in extension. In other words, extension motion is restricted. Now move your patient's humerus into flexion. Again, stabilize the scapula with your cephalad hand and try to see if you can appreciate the barrier. Again, if you feel restriction here, you will name this right extended glenohumeral joint. Moving right ahead with abduction with internal rotation, stabilizing the scapula, try to see if you can appreciate the quality of the barrier at the end of abduction. If the barrier is reached earlier in abduction with restriction, then you would name this right adducted glenohumeral joint. Finally, move your patient's humerus into adduction and external rotation, again looking for the quality of the barrier. If the barrier is reached earlier with restriction in motion at the end of adduction, then you would name this right abducted glenohumeral joint.